All right, so we're here this morning with Ann Hollywell. And Ann came in probably about 3 months ago, 2 or 3 months ago, to start care with us because she was having a variety of issues, one of which her major complaint was the inability to lose weight, but she also had a problem with sweating and some other things. So, Ann, go ahead and talk a little bit about what brought you in and what your experience has been since you've been here.
Well, I'm a healthcare professional myself, and I had got totally frustrated with the fact that I could not shed any of my weight that I had gained. And it is now the 12th of December, I believe, and I started working with Dr. Lawrence at the beginning of August, and I've lost almost 40 pounds. Energy levels are way up. Mm-hmm. I was very uncomfortable in the mornings. Once I got out of the shower and attempted to dry my hair and get dried, I would sweat profusely. Mm-hmm. Within a week, 2 weeks of working with Dr. Lawrence, that had really become a thing of the past. I can't say how much I've enjoyed working with her. It's been a great experience, and the results that I've got, I've been absolutely delighted with, and I couldn't ask for anything better.
We know the great thing is that it's always the patients make all the difference, because I can tell you what to do, but if you don't want to do it, or if you don't want to, if you don't choose to make the right choices in your diet and whatnot, it's all for nothing in a lot of cases. So the success that we see in our office, number one, comes from us being able to put you in the right direction, but really number two, it comes from the willingness of the patient to do what's necessary to get well, and you did just that.
Right. Well, I always say to the clients that I work with, I can give you the tools,
right,
but it's up to you whether you take those tools out of the toolbox and use them, or whether you leave them there. And it does take a commitment. And obviously I know myself that working with somebody who is compliant, mm-hmm. you're going to get better results. And I mean, we didn't at home have a bad diet. I make everything from scratch. Most of the produce mm-hmm. that I buy is organic. And just with Dr. Lawrence's help, those few tweaks, it really set the metabolism into gear, and here I am running circles around my husband and children.
That's good. It's always nice when you go on vacation or you see people you haven't seen for a while, and they tell you how much different you looked, and you had that experience as well.
Yeah, well, actually, I was out last night at a Christmas event, and a couple of people came up to me and said, "You look hot." But not meaning that I was hot,
but
and
not
sweaty.
sweating. But in the good way.
In the good way, yes.
That's awesome.
Yeah.
We're going to check back with you in a couple more months. But everything's been going really well, and I just appreciate you, just being a great patient, because you make a great testimonial.
Well, I appreciate you being a great doctor, so thank you.
Thank you, Ann.